What's up, tumnadlectures? In this video, we are looking on part 2 of what we call the cardiac conduction system. If you find this video helpful at the end of it all, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now in the previous video, we looked at the basics of what we call the cardiac conduction system. We looked at the different kind of the cells that make up what we call the myocardium. We looked at what we call the contractile cells and the non-contractile cells. In this video, we are going to be mainly focusing on what we call the non-contractile cells, or which we are calling the autorhythmic conducting cells, or what we are calling the nodal cells, how they are going to be generating the action potentials, and how it's going to be running throughout the entire myocardium to cause what we call the contraction. Okay, that's going to be the main reason for today's video. But before you go into that, we need to first take an orientation of this diagram, and we see exactly where do we find all those different kind of the autorhythmic conducting cells, which we are calling the nodal cells. Okay. Now, we said that the heart exhibits a principle which we call automaticity. And what is automaticity? We said that automaticity is that intrinsic ability of the heart to spontaneously depolarize, and it sends the action potentials which move throughout the entire myocardium and causes what we call heart muscle contraction on its own without anything like external effect. And we say that the SA node generates all this kind of the automaticity, and he can make the heart contract 60 to 100 beats per minute, which is a normal sinus rhythm. Okay, so now that one is something which is super very much best. Okay, now we need to first go ahead and see how do we call all these kind of different structures of what we call the cardiac conduction system. We have been talking about SA node, the sinoatrial node. We need to first understand where is the sinoatrial node going to be located. The sinoatrial node is going to be residing within what we call the right atrium. But to be more specific, it's going to be just next on the entrance of what we call the superior vena cava. That's where you're going to be having a specialized type of structure which sets the sinus rhythm, which is sometimes named as what we call the natural pacemaker. And that kind of the structure is what we call the SA node, sinoatrial node. Okay, so now this structure here is what we call what we call the SA node. Okay, and then when we come down here, we also have another kind of the beautiful kind of another kind of the nodal cell. This kind of the nodal cell here is what we call the atrioventricular node. Okay, this one here is what we call the atrioventricular node. Super very important. And then when we come down here on what we call on the septum, we also have another kind of the non-contractile cell, or what we call the autorhythmic conducting cell. This kind of the structure here is very much special. This one here, which is a bit green, that one is what we call the atrioventricular bundle. But there is another beautiful term for it, which we call the bundle of His. Okay, so now this one here is what we call the bundle. The bundle of His. Okay, but it can also be called the atrioventricular bundle. Okay, now as this bundle of His moves down within what we call the interventricular septum, it splits into to have this one which is going to be the right bundle branch, and then this one is going to be the left bundle branch. So now this one here, we see this one here, and then this one here. These are going to be what we call the bundle branches. Okay, they are going to be what we call the bundle branches. And of course, when we talk about the bundle branches, we have what we call both the right, and then we also have what we call the left. Okay, and then from what we call the bundle branches, we also have these tiny these fibers which are going to be embedded deep within what we call the ventricular myocardium. These ones here are super much special. But these ones here are what we call the purkinje, fibers. Okay, are what we call the purkinje fibers. Super very important. Now, to come back here, when you look on the SA node, we have these beautiful the branches. You see, these kind of the fibers here, these ones here, these bundles. These bundles, they have their specific kind of the name. Okay, let's first breathe and call this one, for example, A, and then we call all these ones here, we call them as B. So now let's bring them here. So now this one A here, when this kind of the SA node generates this kind of the action potentials, this is the SA node which is going to be generating the action potentials. Once it generates the action potentials, it is now going to be spreading now this kind of action potential throughout what we call the entire kind of the atria. So now these are going to be the bundles which are going to be taking the action potentials from the SA node and they spread it into what we call the left atrium, and even also from the SA node and then they spread it to the entire kind of what we call the right atrium. These kind of the bundles, they also have the specific type of the name. This one here, which is spreading the action potential to the left atrium, this one here, which we have called A, is what we call the Bachmann's bundle. Okay, is what we call the Bachmann's, is what we call the Bachmann's bundle. Okay, what we call the Bachmann's bundle. Okay, and then from this one here, from the SA node to the right atrium, this kind of the structure which is delivering the action potential to make sure that even also the right atrium also contract. These ones here are what we call the internodal pathways. We have labeled them as B. Okay, we have labeled them as B, and we have said that these ones are what we call the internodal pathways. Okay, the internodal pathways. They are super very important. Now, when the SA node generates the action potentials and it spreads them throughout the entire kind of the atrium, and it causes the atrium to contract and they push the blood down. Now, this kind of the action potentials is going now to converge back on this kind of this structure here, which is super very important. Now, when these action potentials they are, for example, in the left atrium, they will not cross down into what we call the left ventricle. They have come and converge this kind of structure here. It is the role of this structure here to allow the conduction of the action potentials to move down to what we call to the ventricles. And that is why it is called atrioventricular node. It is taking these kind of action potentials from the atrial side down to what we call to the ventricles. It is such another beautiful thing. And we said that this one is what we call the atrioventricular node. Now, what is very beautiful is that this atrioventricular node, it has the ability to hold these kind of reaction potentials, to delay these kind of reaction potentials for approximately 0.1 second. Okay? And there is a reason for that. Why is that the AV node holds the action potentials for approximately 0.1 second? The reason is we want to give enough time to the atria to fully contract and push the blood into the ventricles and give enough the ventricles time to fill with the blood coming from the atria before the ventricles contract. Okay, so now we are giving enough time to the atria to contract and push the blood into the ventricles before the ventricles contract. That is the reason why the atrioventricular node holds the action potentials for approximately 0.1 second. But we also have some other kind of microscopic kind of the reasons as to why there is a delay of 0.1 second on AV node. When you extract a tissue on what we call the AV node and you look at it microscopically, you realize that these kind of the cells which are going to be making what we call the atrioventricular node are going to be having a very small diameter. And of course, if it has a very small diameter, it's going to be now having a lot of high resistance in conducting of what we call the action potential. That one also can slow down what we call the movement of what we call action potentials. It is not like, for example, the purkinje fibers, which allows the faster movement of what we call the action potentials. Besides that, when you look on this tissue of what you call the AV node, their cells are going to be having few gap junctions. Okay, they're going to be having very few what we call gap junctions. So now the fact that it has a few gap junctions with a small diameter, that one also explains why there is a delay of 0.1 second of the action potentials from crossing from the AV node down to what we call the ventricles. Okay, it is also such another beautiful thing. Now, after the AV node have allowed the passage of what we call the action potential to move down to what we call to the ventricles, they pass through this structure here, which we have called the bundle of His, or which some other people call the atrioventricular bundles. Okay. Now, this bundle is going to be passing through this tissue structure, which we are calling ventricular septum. But eventually, it is going to be splitting into two. Okay, it is splitting into two. This one is going to be what we call the right bundle branch. It goes down and then it starts now splitting into the tiny the fibers. Then even also the left bundle branch will move down. Then it goes to the left side of the myocardium, and then it starts splitting off into other tiny the structure. Now, these ones here are what we call the bundle branches, the right and then the left bundle branch. And then from there, once they move the action potentials down, it will now move to these very many tiny these fibers, which we are calling the purkinje fibers. And these purkinje fibers, they are deeply buried within the apex of what we call the ventricular myocardium. They will be stimulating these the heart muscles within the ventricular myocardium, and they cause them what we call contract. Okay, so this is how the cardiac conduction is going to be working. So now let's just have a quick brief recap of what we have just said. We said that the SA node is going to be responsible for generating what we call the automaticity, generating the action potentials. It generates the action potential which moves the left atrium through what we call the Bachmann's bundle, and then to the right atrium through what we call the internodal pathways. When they make this the atrium to contract, these action potentials will converge on this structure which we are calling the atrioventricular node, and this atrioventricular node is going to be holding these action potentials for approximately 0.1 second. And we have said that the reason for this is that we are giving enough the atria to contract and push the blood into the ventricles before the ventricles contract. And we went ahead and said that these the atrioventricular nodes microscopically are going to be containing few gap junctions and even also having a small diameter. And because of that, that one also explains why there is a delay of 0.1 second by the action potentials passing through what we call the atrioventricular node. We said that the action potentials from every node, they move down through this this structure here, which we are calling the bundle of His, which is going to be passing through what we call the interventricular septum. From where it is going to be now splitting into what we call the right bundle branch and then the left bundle branch. And eventually, when they reach at the apex of what we call of the heart, they start now branching into these tiny the branches, which we are calling the purkinje fibers, which are going to be stimulating these the ventricular muscles and cause them to contract. Okay, now that we have explained all that, let's just put that one in writing as we summarize. We said that the action potentials are going to be starting from what we call the SA, from what we call sinoatrial node. Okay, from the sinoatrial node, we are going to be seeing that these the electrical messages will come and meet what we call the atrioventricular node. Okay, atrioventricular node. From the atrioventricular node, the action potential will move down to what we call to the bundle of His. From the bundle of His, the action potential will move down to what we call to the bundle branches. Okay, to what we call to the bundle branches. And we have said that the bundle branches, they're going to be having what we call the right and then what we call the left bundle branch. And then finally, from the bundle branches, our action potentials will reach what we call the purkinje fibers. Okay, and then once they reach the purkinje fibers, even also the ventricular myocardium will also contract and push out the blood. So now this is a step-by-step in what we call cardiac conduction system. And the first step is this one, the second one is this is going to be the third one, this is going to be the fourth one, and this is going to be what we call the fifth one. Okay, so now that briefly covers the cardiac conduction system. Thank you very much for watching, and if you think whatever I've talked is making sense, is adding to you or benefiting, please, you can hit the like button, comment down in the comment section, and please subscribe. As always, Tumnad, until we meet next time.